We all know that in old age, men and women have weaker bones, and then falls can cause fractures. We would have thought that with medical science moving along, so well, we would have thought that with advances in science, maybe we will be seeing less of it. But unfortunately, we are seeing a lot more of weaker bones in men, especially because of use of steroids for fitness and great looking bodies. We see a lot of bone thinning and weak bones in women who are too thin, and so they don't have enough calcium. And then we are seeing this obesity epidemic, which also leads to thin bones because there's low vitamin D. And then comes the stress and the hormones that the body produces as steroids. The stress also leads to more caffeine consumption, which does not prevent calcium absorption. So we are actually seeing a lot more of weak bones and fractures and even damage to joints in an early age because of use of treadmills by very overweight people. You need to keep your bones strong, and you need to start early. You need to listen to your mother when she says, have your milk. You need to take calcium, but calcium needs to be absorbed. If you're taking calcium and taking lots of caffeine, the calcium will not be absorbed. If you are taking the calcium and not having enough vitamin D, the calcium won't work. So for the vitamin D, you need to be in the sun. And in our population, especially from the subcontinent, we are very deficient in vitamin D. And so vitamin D is required for the calcium. Then a lot of people who are taking enough calcium and maybe enough vitamin D are still having weak bones. That especially includes women who are very thin, people, men and women who are actually very obese. So they will also have weak bones. So what else can you do? You don't really want to sit in the sun for hours. Tanning is good, but skin cancer risks, and then you don't want to get too dark. So you get your vitamin D tested, and if you're deficient, then start having the vitamin D. So calcium can be coming from the diet or supplements. Vitamin D can be coming from the sun or supplements. Then you need to get these to your bones, right? You need exercise for that. You need weight training, because the blood vessels that are going with the muscles, they are the ones that they're going to take it to the bone so that the calcium is deposited there. So it's not just any exercise, it's weight bearing exercise. So what do I mean by weight bearing exercise? It can be, you can do weight training in the gym, or you can do body weight exercises like Pilates and yoga. Now in women especially, the bone thinning or the bone weakening or the osteoporosis actually accelerates after the menopause. Menopause, when the periods stop, which is around 50 years of age. So in these ladies, because when the menopause starts, the estrogen goes down. When that estrogen goes down, the bone starts thinning out, the calcium is lost, and new bone formation is not going on because that requires estrogen. So for that is where we come in. We can give you hormone replacement therapy, which contains estrogen, which then will keep your bones strong for longer. But it needs to be given in a very controlled way. Trust me, this estrogen that we give for hormone replacement therapy carries no increased risk of cancer if we have screened you properly. We have to run some tests, we have to look at your history, your risk factors, and then we can safely give you hormone replacement therapy, which will prevent bone thinning. Nothing else works as well in women to maintain their bone strength as does hormone replacement therapy containing estrogens, right? Women have to continue taking their calcium, they have to continue taking their vitamin D, and they have to continue weight bearing exercises, right? Then there are scans that can be done to check your bone thickness, your bone strength, which is bone density. These bone density scans are called DEXA scans, DEXA. So when DEXA scan is done, there is a score that is compared to the normal population, and then that score tells you the risk that you are at for fractures because of bone thinning. So there is thinning of the bone starts with osteoporosis. osteopenia, that means reduced thickness, and then there's osteoporosis, which is a more severe form of bone thinning. So when we get this DEXA scan done in a lady who we feel is at a high risk of osteoporosis or bone thinning, then we start her supplements according to her age and her circumstances and all the history. There are other supplements. Actually there are a series of other supplements which are non-hormonal, which can be given in those women where we can't give hormone replacement therapy. Maybe they have a personal history of cancer, maybe they have a family history of cancer that prevents us from giving those hormone replacement therapy. So we can give those bisphosphonates and other things, lots of other things, but they don't work as well. So if you start looking after your bones when you're young, take the milk that your mommy tells you to, go out in the sun and play outdoors when you can. Then when you're growing up, stop avoiding the sun, keep up the calcium intake, don't take too much caffeine, don't take steroids, and learn to do all kinds of different exercises, especially weight-bearing exercises or strength training. It's about the same. In strength training, you work with maybe machines and weights mainly, and in a gym, and you strengthen muscles around a joint. They support the joint as well as improve the circulation to the bone. In other weight-bearing exercises like yoga and Pilates, and you work on the whole body and maybe different parts of the body together, and in that you use your body weight as a challenge and build muscle strength, and again improve circulation to your bones. And if you're very thin, please get your bone density tested around 40 years of age. If you're very overweight, please lose that extra weight, because your vitamin D levels are going to be low, your bones are going to be weak, and that extra weight is also going to mess up with your joint. So look after your bone health. Thank you.